did you know that if everybody knew their HIV status, we could completely stop it? That's true. We want to talk about it more with Misty Thompson from the Utah Department of Health. Hi, Misty. Thanks for being here.
Thanks for having me.
Okay, so first things first, let's talk about, you guys have a campaign that you're doing. Tell us a little bit about it.
We do. It's the Getting to Zero campaign. It's a collaborative initiative amongst HIV medical care providers, the state and local health departments, as well as community-based organizations, with the end goal being zero HIV deaths in Utah, and hopefully resulting in zero HIV-related new infections as well.
Wow. Well, and I think a lot of us, we've all been very focused on COVID this last year, but this is still a real problem. So what is HIV? Just let's get that out there first.
Sure. HIV stands for human immunodeficiency virus. It's a virus that attacks a part of your immune system, your T cells. If left untreated, HIV can attack those T cells and deplete them, resulting in an AIDS diagnosis. I think many of us are kind of familiar with what happens when somebody has AIDS. That definitely results in a fatality typically.
Yeah, and let's talk about the test, treat, prevent, and respond.
Yes, so those are the four main components of our initiative. Testing absolutely helps us achieve these goals because somebody is able to know their HIV status, and knowing your HIV status is the key to being able to treat it and prevent the spread. And then treatment, of course. There are many different medical treatments available for somebody living with HIV, and if somebody is using those treatments, then they're able to achieve something called viral suppression, which allows them to not be as infectious, right?
Okay.
So if their virus is suppressed, they can't spread the virus as easily. Prevention would be part of that as well. There are many different ways to prevent the spread of HIV, knowing your status, testing, treatment, and then using barriers and different precautionary measures. And response, just responding to those different outbreaks. If there are cluster outbreaks, and working to help people identify their status and then treat that status.
Now, I think there's a lot of confusion on how it is transmitted and how it is not. So let's start first with how it is transmitted.
Yes. So the most common methods of transmission for HIV are sexual contact with somebody who is HIV positive and not virally suppressed, or also sharing needles with somebody who is HIV positive. So it's not that easy to spread, but those two methods could definitely lead to an infection.
Yeah, and I think we meant common ways that one was spent or transmitted on the last one on our full screen. But then let's talk about the ways where it's not transmitted.
Yeah, so HIV cannot be transmitted through casual contact. You cannot transmit HIV through hugging, even kissing, sharing beverages, food, air, water, insects, right? Yeah, so it's not spread very easily through common contact.
Okay, and then as far as blood testing goes, where are we on that?
So there are several different ways to test for HIV. There are some blood testing methods that are available, but if you're a little skittish about having your blood taken to have an HIV test, never fear. There are lots of other ways to go about being tested as well. Some just an oral swab.
Perfect. Well, and if they do want more information, and they can also go there to view more about your PrEP program, tell them your website.
HIV and Me, that is the new website launched by the Utah Department of Health. Lots of different resources available on that website, as well as lots of different information.
Great. Well, thank you for all the info and for being here, Misty.
Thanks so much for having me.